I'm Dr. Beech. A patient came in this morning and asked me, what is this thing that you do called Ayurveda, and can I do that? Will it help me? And she had weight problems, high blood pressure, uh, headaches, pain in the body. And my answer to her was, yes, it can help you for sure, because I've helped lots of patients with many, many symptoms, those included. But in full disclosure, I wanted to tell her, and I did tell her, what are some of the challenges of using this, especially this type of Ayurveda. And that is, this system comes from a 5,000-year-old source. And the way that we treat are through traditional methods. The first method, the most important, is that we use food as medicine. That means that the quality of the food that's coming into the body has to be the best. It just has to be. That means that, as I told her, that nature's intelligence is in the food that we eat. And I was explaining to her what that meant, is that intelligence means that it's alive. That when the food is alive, it has not only the chemical components of the food, but it also has that more intangible quality of vibrating life there. And I explained to her that if you took a peach off of a tree, a nice fresh peach, and I slice it up, put it in a bowl, and then I take a can of peaches and put that in a bowl and offer it, which one would you take? And she said, of course I'd take the fresh one. And I said, why? And she said, because it tastes better. I want that. It would be sweeter and taste better. And I said, but if we took those two peaches and we put them in a machine and we analyze them for their nutritional content, it'll say they're the same. It has the same carbohydrates, same proteins, same fat, same vitamins, same minerals. Everything will be the same, assuming they didn't put the peaches in a lot of sugar that's in the can. Maybe it's frozen peaches. The content, the nutritional content would be the same. I said, if that's the case, if they're exactly the same, why would this machine, you, reach for the fresh peach rather than the canned peach? And she looked at me and said, well, because it tastes better. And I said, yes. And that means the life that's in you, the intelligence that's in you, interacts with the intelligence that's in the fresh peach. And because of that, you want that. You don't really know why. You just know it tastes better. Okay? You can eat the other ones, and it'll taste good maybe on the tongue. But when you eat the fresh peach, it tastes good on the tongue, and you actually feel something as it goes inside. That's the intelligence. And the way I like to explain that is that when we eat intelligent food, it's like we're getting the instructions of what to do with that food. The intelligence that's in us interacts with the intelligence of the food, and the body knows exactly, oh, this protein I need for my liver. This fat I need over here in my brain. This sugar, I need this in that cell. So on and so forth. It knows because that intelligence interacts. The intelligence interacts with the food. Now, when we eat food that's been frozen, or it's been a leftover, more than 4 to 6 hours old, we say that kind of food is, if it's a leftover, we call it dumb, meaning it's not as intelligent. It's kind of dumb. The body will, instead of going like this, like a perfect fit, it'll just maybe go like that. It doesn't fit together perfectly because it's a little too old. And if it's dead food, meaning it's more than 6 hours old, it's been refrigerated overnight, or it's been frozen, it's in a can or a box, it's like this. The body looks at it and it goes, well, I know that's a protein, but I don't really know what to do with it. And I know this is a vitamin, but it doesn't quite make the same sense to me. So this is where our digestion starts to become weak. And what happens is our digestion, if we start giving it that kind of food all the time, what happens is our colon and our liver and the rest of our body has to dumb down to meet that level of food. In other words, it has to reduce its own intelligence in order to make use of that food. Because at first it'll just reject it. It'll just, this isn't any good, and it'll throw it out. But after a while, we'll adapt to it because we are adaptable. And in that adaptation, we have to dumb down to that level of food. So I was telling her that in this practice we have to have intelligent food, and then in the same way we have to make those organs of digestion, our stomach, our gut, meaning our colon and our liver, very, very intelligent so that they wake up and do their job properly and stop making different kinds of toxins in the system. And we'll talk about the different kinds of toxins in another video. And so I explained to her that part of this system means having to cook, having to make your own food. It doesn't mean you can do it 100% of the time. Nobody can, but more than often. She told me that she never cooks, and that's not enough. We have to do better than that. So I told her we would have cooking classes, that we try to really support our patients by walking you through the steps and showing you how to, what foods to use, what spices to use, how to put them together. My wife Prabha even offers cooking classes, so you can come to our home and watch her cook the food and actually taste it and see what it's like. So we really support our patients on this because using food as medicine is so, so important, but it's hard. I make my lunch in my office in Bethesda when I'm there for 12-hour days. I take a crock pot, and I have a crock pot there, and I have a little box with some spices and ghee and lentils and rice and quinoa and all these different things in it that I can store there at the office. And then every night I chop up some vegetables and I make some paneer or something, some nice protein, and then I take that to work with me, and about 7:30, 8 o'clock in the morning between patients, I put that in the crock pot and I turn it on and I cook it. So I have a nice lunch ready for me because lunch is the most important meal of the day. And if I get lazy and I don't do that, I can feel it. In the afternoon, I just don't have the same energy. I don't have the same brightness in my mind, the same intelligence there because I've eaten dumb food. I had to eat, a sandwich or something, and it doesn't feel the same. So it's important enough that when I know for my own self that doing it makes a big difference in how I feel. And so I want all of my patients to feel that as well, especially in this tradition of Ayurveda, the Shakavansi Ayurveda, that we have to pay attention to because the quality of the food, the quality of the digestion are so important. It says in the ancient text that without the proper diet, medicine doesn't work very well, and that if diet is proper, medicine isn't needed as much. So it's an extremely important aspect. So I hope you've enjoyed this, and I welcome your questions, and we'll talk more later. Thank you.